So continuing in our series about rhinoplasties, I'm going to discuss revision rhinoplasty now, which is definitely the most difficult of the rhinoplasty procedures that we perform. Almost all of them are done open, which means an incision under the base of the nose here, so we lift the skin envelope up. And the reason for that being is that you just never know what you're getting yourself into with a revision rhinoplasty. Even if I've read the other doctor's op note, which I don't always have, but sometimes I do, frequently when I get into the procedure, the op note does not really correlate with what I'm seeing, so it's of some use, but sometimes it's not. So you never exactly know what you're going to get, just like Forrest Gump, like a box of chocolates. Just don't know what you're going to get. So an open approach is definitely the best way to approach a revision rhinoplasty. Again, with all rhinoplasty, you need to see somebody with gray hair. Don't fall for gimmicks, imaging, which is very easy and I think is almost misleading patients, because you can never guarantee you can produce the image you're showing the patient. Easy to do the imaging, hard to do the rhinoplasty. The use of harmonic scalpels, that's another thing that's come up lately, that people are saying that's a better way to do rhinoplasty. Well, the scalpels don't do the surgery, the surgeon does, and whether you're cutting with an harmonic scalpel or a rail scalpel, you still got to know what you're doing. So I don't actually trust them that much, because I don't believe I can control where they're cutting as well as I can with sharp osteotomes and the way I do rhinoplasty now. So gimmicks don't do rhinoplasties, surgeons do. So make sure you see someone with gray hair, experience, and who specializes. So I'm going to go over some cases next. So revision rhinoplasty is the toughest stuff that we do. This patient is a 40-year-old female. She's 17 months post-op, and she basically was left with a nose that looked almost as bad, apparently, according to her, as her pre-op nose. Of course, I don't have her pre-op pictures. They were done elsewhere. And we were able to give her a nice-looking nose that fit her face, fit her ethnicity, and didn't look like it was done poorly. So she was quite grateful. This next patient is a 28-year-old, and she's only 6 weeks post-op, and you can see the improvement in the appearance of her nose even at 6 weeks. Again, revision rhinoplasty is difficult. You've got a lot of factors you have to take into consideration. You never know where you're going to see when you get in there. You have to have cartilage available if you need it. Get the cartilage either from their ear, sometimes from their septum, occasionally from a cadaver. This next patient is a 35-year-old female who, again, did not have an attractive result from her rhinoplasty, and she is now 6 months post-op. Same thing, just trying to make her nose look like it fits her face. It's always a task for revision noses to make them look as pretty as we can, but something that I feel like I'm pretty good at doing after all these years. And again, she was quite happy with the change. The nose fit her face much better, and she felt much more confident. The final patient, as we can see here, is a 45-year-old female who's 3 months post-op. Same thing as the other ones. Very unattractive nose that we turned into a nose that did not detract from her looks, gave her a lot more confidence, made her feel much better about herself, and we were very happy to be able to please or improve this patient's outcome with the revision rhinoplasty.